Hey everyone, I'm Jennifer Henry and I'm a Senior Associate and Interior Designer at Davis Partnership Architects. It's my pleasure today to talk to you about a really exciting project that we wrapped up just a few years ago, the Colorado Health Foundation's new headquarters. It's a really beautiful project created for a group of really beautiful, inspiring people. Just to give you guys a little bit of background, the Colorado Health Foundation is an amazing organization who work every day with community nonprofits to provide tools, leadership, and funding to address social, physical, and economic health around Colorado. It's their mission to make Colorado the healthiest state in the nation.
Bringing health in reach for all Coloradans is really about leveling the playing field. It's about understanding that health is not in reach for a lot of people today. There are places in Colorado where there's absolutely no access to primary care. There are neighborhoods here in Denver that don't have access to fresh and healthy food. There are places that if you had a prescription, there wouldn't be a pharmacy within 30 miles. So inequities exist everywhere we look. It's really about understanding who's affected by those inequities, what are the root causes of those inequities, and how can we partner with communities to address them.
At our very first visioning session with our client for the new headquarters, we were asked, what would one of the healthiest offices in the whole world look like? How can we create a building where occupants and visitors are healthier just as a result of interacting with it? And how can we create a project to become a role model, exemplifying health and well-being in the workplace? Our design team already knew we wanted to pursue LEED for its environmental sustainability attributes. But learning more about our clients' goals and sticking to their really great mission, it became really clear that we really needed to focus on human sustainability as well. And that's where the Well Building Standard came in. The features from both a design and operational standpoint of this metrics aligned with everything we hoped and aspired to for our project. Now I'm going to take you guys through the well building strategies we used on our actual project to become well accredited. The Well Building Standard takes a holistic approach to health in the built environment. It addresses behavior, operations, and design. And it's broken into these features: air, water, nourishment, light, fitness, comfort, and mind. So I'm going to do a deep dive in the project now and show you what we did for each of these features. The first feature is air. Air quality is really important to human health, and there's sensors at all the windows in the project to gauge how the air quality is, and even better, the windows are operable. So you can be in your office and decide to enjoy the day, open your window, get a breeze. When you enter the project, there's this giant 3-story green wall that greets you. So tons of oxygen producing plants right there in the lobby. And there's just access through the outdoors throughout the entire project, from the main level all the way up to the top level, rooftop decks, different areas to go enjoy the day. The next feature I'm going to talk about is water. There is a filtration system throughout the building. There's lots of access to water from water fill stations on each level. And then there's also an innovative art display that we did on this building. So not only does the building collect the rainwater and use it, but it also makes an interactive display by doing so. Nourishment. Access to healthy food throughout, an orchard at the entry of the building, an herb garden, staff kitchens on every floor, and juice bars on every floor. Light. So as I mentioned before when I was talking about natural ventilation, we have a 48-foot depth floor plate that allows that natural air to come through when the windows are open. It also allows for the sunlight to pour into the space. So everyone has this great access to natural light. Okay, let's talk about fitness. So there's a couple of different strategies we use to address fitness on the project. First and foremost, we have this beautiful, grand sculptural stair, encouraging people to skip the elevator and take the stairs. We also have a fitness room, a fitness deck, and a few other things that we'll talk about, including bike storage and locker rooms. The comfort feature. Sound masking system, thoughtful interior finishes to aid in further acoustic comfort, variety of workspaces, ergonomic furniture. These are all things that are incorporated in the project. The last feature is Mind. Natural and healthy materials are used throughout the facility. This was one of those features that really went hand in hand also with LEED version 4. This is one of the first projects where we had to kind of collect those HPDs and EPDs on all of the interior materials that went into the project. So now that you see how we achieved well on this project, and I think successfully used all of the different features throughout, I just wanted to touch on a couple quick lessons learned and things that hopefully you guys can implement on some of your projects. First and foremost, the process for integration and certification has truly been from start to finish. I truly believe you cannot engage many of these features midstream and be successful in the long run. So basically, get buy-in from your client, make sure everyone's on the same page and committed to really see this from the start to the finish. There is a bit of change management needed that you'll have to walk your client through because, like I said, not everything in well is in the designer's hands. It's also operational. You need to allocate staff time and fee to document well. A lot of the graphics that I showed today in the presentation we actually used for our well submission. So it's not like they're not ever going to be created for other things, but you do just need to allow time for that documentation process to happen. It's a good idea to confirm all the roles and responsibilities between the architect, the sustainability consultant if you have one, as well as the contractor. There is a lot that the contractor needs to know about as well. On this particular project, we worked with Saunders and they were just fantastic from the beginning to the end. Like I said, you'll produce diagrams. A lot of these will just kind of come out of Revit or SketchUp, things that you might already produce. You'll need letters of insurance, and those are written by both the client and the architect. You'll need professional narratives that will come mostly from the architect and some from the sustainability consultant. You'll keep track of things using spreadsheets, your integrative health process, if you will, and material information like I was talking about. You'll do that if you're going LEED, so collecting just those HPDs and EPDs. So that's one of those dual efforts that you're doing it probably for LEED, it'll also work for well building, which is great. So now that we've gone through all the attributes and features on the project, hopefully you can see what a joy this project really was to work on and just to be a part of. It really was through the integration of architecture, interior design, lighting, landscape, signage design, that we were able to create a high-performance building that promotes an active, healthy workplace. We really believe that those that interact with this building are healthier as a result. And again, the result of these systems placed the Colorado Health Foundation as the first building in the U.S. to receive both Gold LEED certification version 4 and Well Building Gold for design and construction. So in closing, I truly believe that it's our responsibility as designers and creators to consider everyone and everything that's impacted by our work. A project's impact extends beyond its occupants or future generations or people elsewhere in the world. It falls upon every living being, each and all alive today and in years to come. So I hope that the Colorado Health Foundation project helped give you a little bit of a roadmap for achieving well on your next project, or perhaps inspired you to go after the well building standard on your next project. Thanks.